Are you also having the tight neck that hurts all the time? If yes, then I have a perfect solution for you. After watching this video, I can assure you that you don't have to binge watch anything else on YouTube regarding neck pain, because I have covered everything for you. Just grab something healthy and watch it. When you first get the symptoms, which is also called acute phase in medical terminology, the treatment plan is very simple. Just you have to follow these 3 steps. First is heat pad or ice pack. Use heat pads if you feel muscle tension and tightness in your neck for 5 to 10 minutes until you feel the circulation really going on. If you feel there is a spasm or swelling at the neck hump where your neck meets your upper back, you can go for an ice pack for 5 to 10 minutes. The second is NSAIDs, non-steroidal anti-inflammatory drug. You can use the anti-inflammatory drug from your local pharmacy like Advil or naproxen to reduce the inflammation. Third is gentle stretching. Here you don't have to do any exercises, just gentle stretches will work to free up that tight muscle. In gentle stretching, you can just slowly tilt your head on one side, bringing your ear towards your shoulder, hold for 5 seconds and repeat on the other side. You can also attempt a rotation stretch, where you will move your head on each side and hold that stretch for 3 to 4 seconds. These 3 guidelines are important for relieving your pain, but they are not an ultimate solution because you have to also treat the cause of pain. So let's move to the main part of the video, which is the long-term solution. This has personally helped me a lot to avoid my neck pain from past 6 months. Before moving ahead, if you are learning something new today, don't forget to like this video as I share health advice which I personally find scarce on YouTube, but it can make a huge difference in your well-being. Now let's get to the video. I know there are tons of exercises on the internet, but I would suggest you to do only these 5 because I think the rest of the exercises just don't work. Don't get me wrong here, there are exercises that can be supplemented with these, but I personally prefer these 5 because they are the most important ones to do. The first exercise is neck curls. It strengthens the deep neck flexors on front of the cervical spine. To perform this exercise, lie on your back on a flat surface like a bench or your bed. Let your head hang slightly off the edge, so your neck is unsupported but safe. Gently tuck your chin towards your chest, engaging the muscles in front of your neck. Slowly lift your head off the edge, curling your neck towards your chest. Pause for 3 to 4 seconds on the top of the movement. Slowly lower your head back to the starting position in a controlled manner. Repeat for 10 to 12 reps. The second exercise is lying neck extensions. It strengthens your deep neck extensors and trapezius muscle. To perform this exercise, start with your head hanging down facing the ground. Slowly lift your head up until your neck is in line with your back. Pause for 1 to 2 seconds at the top of the movement. Lower your head back down in a controlled motion. The third is lying lateral neck flexion. Lying lateral neck flexion strengthens your scalene muscles and your upper trapezius muscle. To perform this exercise, lie on your side on a flat surface such as a bench or a bed. Cross your hand and keep your head in a neutral position aligned with your spine and your neck straight. Slowly lower your head towards the shoulder of the side you are lying on, creating a gentle stretch in the opposite side of your neck. Slowly return to the starting neutral position. Perform for 10 to 12 reps on one side and then you can switch sides and repeat. Fourth is wall angels for upper back muscle strengthening. To perform this exercise, position your feet a few inches away from the wall. Keep your lower back, mid back and head gently pressed against the wall. Tuck your chin slightly to keep your neck neutral. Tighten your abdominal muscles to prevent your lower back from arching. Raise your arms to shoulder height, bending your elbows to form a 90-degree angle like a goalpost or a W shape. Slowly glide your arms upward along the wall, attempting to form a Y shape with your arms overhead. Then slowly lower your arm back to the starting position. Now the last exercise is for people who go to the gym. But if you don't feel like going to the gym, it's completely fine. You can just proceed with the wall angels for strengthening your upper back. The fifth exercise is chest supported dumbbell row. To perform this exercise, use an adjustable bench inclined at about 30 to 45 degrees. Select a pair of dumbbells with a manageable weight to maintain good form. Lie face down on the bench with your chest supported and your torso fully resting on the incline. Allow your arms to hang straight down, holding a dumbbell in each hand with a pronated grip. Exhale as you row the dumbbell in line with your ribs. Focus on pulling with your elbows and keeping them slightly flared to put more stress on upper back. Hold this top position for 1 to 2 seconds to engage your back muscles fully. Usually people who are working for long hours on chair or have a desk job tend to hunch over a lot. So to avoid this, fix your workstation to correct your posture. Keep your screen at eye level so that you can sit and look straight. Use a chair with good lumbar support to provide stability to your spine. And take breaks every 30 minutes to stretch or walk around, which will loosen your tight muscles. We almost use 1/3 of our day sleeping, so let's use this time to correct our posture. Here's what I personally follow when I go to bed. I roll a big towel like this and keep on my bed. When I binge watch content on social media before sleeping, I lay down on this rolled part with my neck resting on it and my head on the bed. This creates that natural lordotic curve of your neck that helps in maintaining a healthy spinal curvature. This has personally helped me a lot to bring my neck curve to normal. You can also use this method if you have pain and quickly want to decompress your spine after a long day of work. Regarding sleeping positions, I would say just listen to your body and sleep the way you like. But please avoid sleeping on your belly. Neck pain usually goes on following the correct exercises and postural correction. But if your pain lasts more than a week or two and comes with numbness, weakness, or severe headaches, or if it is from a recent injury like a car accident, it's time to see a doctor. Don't ignore it, it's better to be safe than sorry. So there you have it, your no BS guide to treating neck pain. Remember, it's about listening to your body, making small changes, and being consistent. If you found this video helpful, don't forget to share it with someone who might need it. Thanks for watching Health Radar, and I'll see you in the next one.